Hypervitaminosis D. So vitamin D levels are classified into deficient, insufficient, optimal, high, and toxic. So it's all based on 25 hydroxy D level. Okay. So deficient is less than 10 nanograms per ml. Insufficient is 10 to 20. Optimal is 20 to 60. 60 to 90 is high, greater than 90 is toxic. So hypervitaminosis is nothing but overdosage of vitamin D. It is the serum level becomes more than 100 nanograms per ml. It results in hypercalcemia, hypercalciuria, and hypercalciuria is going to cause renal stones. And because of renal stones, there is, anorexia, vomiting, renal insufficiency, hypertension, and failure to thrive. With such an epidemic, so like people came with vomiting and they said, I don't want to talk. I mean, I don't want to eat. And they keep yelling at everybody because of hypertension. And then they don't pee a lot because of renal insufficiency. And they were just, kind of looking like dying, which is failure to thrive. Such an epidemic was reported in England in 1950s due to the high dose of vitamin D supplementation, which is overzealous government intervention causing hypervitaminosis D for literally every single child. Why? Because they gave 2,000 to 3,000 international units per day for several months. I mean, usually we just need it for how many months? So, like, maintenance dose is only 400 to 600 per day, right? I mean, that's like normal. It should be like the RDA. But they kept giving 2,000 to 3,000, which is like the therapeutic dose. Usually it has to stop by 12 weeks, but they just kept giving it for a lot of months, so there is hypervitaminosis. All right, so yeah, that's about it. And then a brief overview about what refractory rickets is. Refractory rickets is nothing but, so we are going to see the biochemical evaluation, but before that we'll see. Rickets that does not respond to the usual treatment of nutritional rickets is called refractory rickets. The diagnosis is based on the patients when there is no radiological evidence of healing after a vitamin D therapy. It is divided into two categories: defects in metabolism of vitamin D and low phosphate disorders. So it's either vitamin D dependent rickets or it is familial hypophosphatemic rickets. The serum phosphate, it can be either high or it can be low or normal. If it is high, it's only one cause: chronic kidney disease. Because chronic kidney disease, the phosphate is not getting excreted. That is the problem. And then if it is low or normal, we check the blood pH. If the blood pH is low, it means that there is acidosis. What acidosis? It's renal tubular acidosis. If the blood pH is normal, we check the serum PTH and serum calcium. If the PTH is high and the calcium is either low or normal, it's vitamin D dependent rickets. Okay, and then if the calcium and PTH are normal, it's hypophosphatemic rickets. Okay. Yeah, so that's about the biochemical evaluation. Refractory rickets. First, serum phosphate is checked for refractory rickets. So, like the usual parameters which are checked for rickets are what? Calcium, phosphate, alkaline phosphatase, and all. Okay, that's it. Thank you.